Welcome to this tutorial on the cross-sectional anatomy of the parotid gland. Today we are using a software package called Virtual Human Dissector. What we are currently looking at are two windows. On the right of the screen is a 3D representation of our virtual human, and on the left is the cross-sectional anatomy at the level of section indicated by the blue semi-transparent plane. The actual level of cross-section is indicated by the lower blue outline on the side of the head nearest to you. We will use this three-dimensional representation to show the overall anatomy and as a navigation tool. In the cross-sectional view, we can highlight and label the structures of interest. It is also appropriate to remind you here of an important radiological convention, which is that cross-sections of the body are viewed as from beneath, as if you were standing at the patient's feet. Today we are going to look at the parotid gland, considering its gross morphology first in 3 dimensions and then in 2 key cross-sectional images. Just to remind you about the fundamentals of the anatomy, the parotid gland is the largest of the 3 paired salivary glands, the others being the submandibular and sublingual salivary glands. Submandibular and sublingual glands. Though salivary gland tumours are rare, when they do occur, they are most commonly found in the parotid gland. About 80% of salivary gland tumours are parotid gland tumours, of which 3/4 are benign pleomorphic adenomas. Benign tumours will not invade the facial nerve, causing facial nerve palsy, but still they must be removed. So in this first part of the tutorial, we will look at the 3-dimensional view of the head, viewed from the lateral aspect. In the 3D view, you can see the parotid gland as a pink mass. It is wedge-shaped, with its superior border at the level of the external auditory meatus, extending beneath the ear and the zygomatic arch and onto the external surface of masseter to just beneath the angle of the mandible. You can also see the relationship of the parotid gland to the sternocleidomastoid, extending on its external surface, both visible in the 3-dimensional and the cross-sectional view. The parotid gland is surrounded by a fibrous capsule which is part of the deep cervical fascia. That splits into 2 leaflets, one on the external surface of the gland and one on the internal surface of the gland to surround the gland. The capsule is innervated by the great auricular nerve, seen here in the 3-dimensional view. Returning to the cross-sectional anatomy, we have highlighted structures as follows. The parotid gland is shown in pink, with its duct highlighted in orange. We can see the arterial structures as red and the venous structures as blue, with the nerves shown in yellow. Muscles have been highlighted in brown, and we have highlighted the mandible in white. Green shows the position of lymph nodes. There are 4 important structures which can be seen passing through the parotid gland in this cross-section. The first is the parotid duct. The saliva that the gland produces reaches the oral cavity by passing down the parotid duct, and you can see the parotid duct curving forwards to pierce buccinator after passing across masseter, opening by the 2nd maxillary molar. In this software, the autonomic nerves of the parotid gland are too small to be visible digitally, and so we will describe that autonomic nerve supply by means of a diagram. The parasympathetic secretomotor supply to the gland comes from the lesser petrosal nerve. This contains axons from the glossopharyngeal nerve, which synapse in the otic ganglion lying on the medial aspect of the mandibular division of the trigeminal nerve. The postganglionic axons then reach the gland as branches from the auriculotemporal nerve. An increase in parasympathetic activity in the gland, to the gland results in increased production of a watery and enzyme-rich saliva. The sympathetic nerve supply is derived from the thoracolumbar outflow. The preganglionic axons of the sympathetic system synapse in the superior cervical ganglion, which is the most superior ganglion in the sympathetic chain. And the postganglionic axons travel to the gland along the external surface of the branches of the external carotid arterial tree in the form of what is known as a periarterial plexus. Increased activity in the sympathetic nervous system in, for example, patients who are nervous in the dentist's chair cause reduction of saliva production and a thick mucous viscous secretion with a dry mouth. Return to the software. We can also see two vessels embedded in the parotid gland, the retromandibular vein and the external carotid artery. External carotid artery, retromandibular vein. You can see that the retromandibular vein is superficial to the external carotid artery. It drains into both the internal and external jugular veins and consequently provides one important conduit for infection spread from inside the face to inside the cranial cavity. As you will know, there is considerable variation between individuals regarding their venous drainage pattern. The pattern normally described and shown in this diagram is of the facial vein uniting with the anterior division of the retromandibular vein, shown here as the yellow arrow, and draining into the internal jugular vein. The posterior division of the retromandibular vein unites with the posterior auricular vein, shown here by the white arrow, draining into the external jugular vein. Finally, and returning to the software, you should observe here, shown in green, the superficial lymph nodes of the head, surrounding the gland on its external surface within the capsule, forming the parotid group of lymph nodes. They can be seen both in cross-section but also in the three-dimensional view. We are now going to move to a second key cross-sectional image to see the facial nerve travelling through the parotid gland. You can see it highlighted in yellow here in the cross-section, and you can see some branches in the three-dimensional window. The facial nerve is superficial to the vascular structures, clearly visible in this cross-section. It passes from the stylomastoid foramen, through the gland, and onto the face to innervate the muscles of facial expression. In the cross-section image you can see the origin of the facial nerve as it emerges and divides into 5 branches, though effectively travelling through it in a single plane, dividing it into an anterior and posterior portion. In this slice you can see the individual buccal branch of the facial nerve emerging from the anterior border of the gland, travelling across masseter and onto the face to the muscles of facial expression. For example, here you can see a branch going to the left zygomaticus major muscle. Return to the gland itself. Deep to it you can see the styloid process with the stylopharyngeus muscle attached. Deep to both those structures, the carotid sheath being outlined now, the internal carotid artery and the internal jugular vein, and then within the sheath as well the vagus nerve, anterior to that the glossopharyngeal, and posterior to the vagus the spinal accessory nerve. Turn to the mandible. Remember shown here in white, medial to the mandible, between it and the medial pterygoid muscle is the pterygomandibular space. Within that space are the inferior alveolar and lingual nerves. It is very hard in individual cross-sections to gain a full appreciation of the pattern of branches of the facial nerve. So once again we turn away from a cross-section to the 3D window and then to a diagram where some of the nerves can be seen. This diagram shows the pattern of branches as normally described, with 5 groups of branches named from the most superior branch downwards as the temporal, zygomatic, buccal, marginal mandibular and cervical branches. These nerves have reached the face by passing through the gland, as we've already seen, and consequently they are vulnerable to damage either by being cut or simply by being pulled, also called traction, during the removal of a parotid tumour. Damage to one or more branches of the facial nerve will paralyse the muscles that it innervates. The testing of the branches is carried out as follows. The temporal branch can be tested by asking the patient to lift the skin of the forehead, because this nerve innervates the frontalis muscle. The zygomatic branches can be tested by asking the patient to blink, because these muscles, these nerves, innervate the muscles of the eye. The buccal branch is usually tested by asking the patient to puff out their cheeks, as one muscle innervated by this branch is buccinator. The mandibular branch is tested by asking the patient to lower the lower lip, And finally, the cervical branch is tested by asking patients to tense the skin of the neck as if they were shaving. In summary then, we have reviewed the anatomy of the parotid gland by looking at the structures that pass through it, and they are the external carotid artery and its branches, the retromandibular vein and its tributaries, the facial nerve and its branches, and the parotid duct. And we have reviewed the autonomic innervation of the gland and some of the deep relationships of the gland.